Signs and symptoms of vitamin D deficiency. Vitamin D deficiency is a common problem in United States and many parts of the world. It can cause bone pain, muscle problem, even mood swings. It also increases the risk of developing osteoporosis and fractures. Vitamin D helps your body to absorb calcium and phosphorus. These minerals help build and maintain strong bones. The best source of vitamin D is sunlight, but you may need to spend time outside each day in order to get enough sun exposure. Vitamin D can also be taken through foods. The only downside is that it is found in very few foods, which can easily lead to developing symptoms of this vitamin deficiency. So in this video, we're gonna talk about the most common symptoms of vitamin D deficiency. Before we proceed, please note that everything mentioned in this video is unbiased, fact-checked and reviewed by qualified health professionals. With that said, let's jump in and talk about the 10 vitamin D deficiency symptoms. Number 1. Weakened immune system. Vitamin D is known as a sunshine vitamin because our body produces it when exposed to sunlight. The sun converts cholesterol into vitamin D when skin is exposed in ultraviolet rays. But many people do not get enough sun exposure. Even if they do, sunscreen block UV rays that lead to vitamin D synthesis. In addition, older adults are at risk of low level of vitamin D because they may have less ability to synthesize this nutrition in response to sunlight exposure. As we age, the skin becomes less efficient at producing vitamin D in response to UV light exposure. Vitamin D is necessary to support a healthy, thriving immune system and to ward off the flu, even the common cold. But if you are prone to get sick all the time, it does not necessarily mean that you are deficient in vitamin D. However, having a vitamin D deficiency might lead to a slower recovery from illnesses caused by weakened immune system. Number 2. Mood swings. Vitamin D is a steroid hormone that acts as a master switch of more than 200 genes in the body. So it makes sense why mood swings are the common symptoms associated with this deficiency. Hormones act as messenger molecules affecting brain and heart health as well as many other organs. If you lack vitamin D, there is a much higher chance you may suffer from more mood swings than someone with adequate or optimal levels. It's especially true for women, as female hormones are more prone to fluctuate tremendously each month. Some may believe that we cannot do anything to prevent mood swings. That's not true. Lack of vitamin D can also be the cause of seasonal affective disorder. This disorder is a form of depression usually sets in during the cold months where there is a lack of sunlight. Number 3. Low energy levels. Low energy levels can be caused by many things, including poor diet, lack of exercise, and stress. However, vitamin D deficiency can contribute to the symptom too. Vitamin D deficiency affects the bones, muscles, and the entire body as a whole. This is the main reason it can lead extreme fatigue and exhaustion. It could also present itself as a daytime fatigue or an otherwise healthy person, or extreme exhaustion in someone with chronic disease or autoimmunity. If you are experiencing any of the symptoms, it could be a sign that you need more vitamin D in your life. And if you are highly concerned about your energy levels, talk to your doctor about checking for it. Liking our video so far? Before we move on the next symptom, don't forget to hit the like button and subscribe to our channel so never miss out to our new informative videos. Number 4. Weakened bones. Right amount of vitamin D, calcium, magnesium, vitamin K is necessary to make healthy bones and to prevent from bone elements. Vitamin D helps the body to absorb calcium from the intestine, which is used to maintain strong bone and teeth. When there is not enough vitamin D, your body cannot absorb enough calcium from food or supplements. As a result, it pulls calcium from the bones, causing them to become brittle and weak. Some bone disorders that may develop because of vitamin D include more frequent broken bones, osteoporosis, and in extreme and rare deficiency cases can also cause wickets. However, bone deterioration over the time can lead to more frequent falls, fractures, and bone disorders. Number 5. Dry skin. Dry skin is a common symptom of vitamin D deficiency. You may notice this as a rough and scaly texture on your skin, which make you look like that you have dandruff and eczema. A new study suggests vitamin D deficiency may be tied to dry skin conditions like eczema and psoriasis. Vitamin D deficiency can also cause ichthyosis. Ichthyosis is a skin disorder which causes dry and scaly skin. This disorder can appear in any age, but it typically appears in a young age. It may be isolated, involving only the skin, or associated with other conditions. So, getting the right amount of vitamin D can help provide the skin with extra moisture, avoiding frequent dryness. Number 6. Muscle spasms. Muscle spasms and the weaknesses are the two most common symptoms of vitamin D deficiency. This disorder can cause muscle cramps, but it is not only about the muscle pain, but it can also result in weakness and even paralysis. In fact, vitamin D deficiency has been linked to multiple sclerosis, which affects the brain and spinal cord by causing inflammation and nerve damage. Multiple sclerosis is strongly tied with experiencing muscle weakness and even pain. First connection between vitamin D and multiple sclerosis was made in 1976, and Danish researchers discovered that people who live at higher latitudes are more likely to have multiple sclerosis than those who have more sun exposure. Since then, several studies have been confirmed that people with low levels of vitamin D are more likely to develop multiple sclerosis than those who have normal level of nutrition. So, to maintain healthy muscles, vitamin D is essential. Along with vitamin D, you also need to make sure that you are getting adequate amount of magnesium, vitamin K, and calcium for maximum absorption. Number 7. Brittle hair. Hair health is another factor for vitamin D deficiency because vitamin D stimulates hair follicles so they can grow well. People who are deficient in this vitamin have more hair breakage, thinning, and overall poor quality of hairs. A study published in a Journal of Cosmetic Dermatology found that women with low vitamin D were more likely to suffer from dry skin and brittle nails. Women with normal levels. The research found that the deficiency in the vitamin D led to reduced level of keratin, the protein found in skin and hair. The researchers believe that this could explain why people with a lack of vitamin D have brittle and dry hairs. Other vitamin and macronutrients are also essential to maintain strong, healthy hairs. These vitamins include B vitamin, vitamin C, vitamin A, and iron. Number 8. Poor vision. Vitamin D deficiency may lead to poor vision because it affects your eyeball's ability to respond properly to light changes. If you are deficient in this nutrient, your pupil won't constrict properly when you enter a dark room. This makes your eyes more likely to become sensitive to harsh light conditions. Optimal levels of vitamin D are necessary to maintain healing and cornea of the eye, promoting clear vision. There are many researches that shows a promising connection between lower vitamin D levels and higher risk of age-related macular degeneration, which is the leading cause of blindness in elderly age. A recent study found that people with low level of vitamin D had nearly twice the odds of having poor vision. In fact, poor vision was present in 1 out of 5 people with low vitamin D levels. Number 9. Mouth ulcers. The mouth is another area to monitor if you suspect this deficiency in this hormone. The deficiency of vitamin D can manifest in the form of mouth ulcers, commonly known as canker sores. Mouth ulcers are the small sores which develop inside or outside of your mouth. They are usually painful red or white patches that can last anywhere from a few days to several weeks. If you maintain good dental hygiene and you're still suffering from mouth ulcers, it cannot hurt to find out what your vitamin D levels are. Number 10. Bleeding gums. Bleeding gums are common and can occur from poor dental hygiene, side effect of prescribed medication, or the lack of vitamin D. Vitamin D helps to produce new blood cells in the body. If you have this deficiency, then your body will not produce enough blood cells, leading to anemia, which can also cause bleeding gums, even across your teeth. You can check if you are deficient in vitamin D by going to a healthcare professional who is specialized in nutrition or integrated medicine. Now let's know about causes of vitamin D deficiency. Vitamin D deficiency usually caused because of lack of sunlight exposure. In general, people who lived at northern latitude above 40 degrees are the greater risk for vitamin D deficiency than those who are nearer to equator. Skin people are also more likely to deficient in this vitamin. This is because of their darker skin pigment blocks the ultraviolet rays needed for the adequate vitamin D production in their skin. Vitamin D deficiency is uncommon in the healthy people who get regular exposure to sunlight and eat a balanced diet. Vitamin can be found in certain types of fish, egg yolks, cheese, and some milk products like yogurt and cereals. Being aware about the symptoms of vitamin D deficiency, you may become more aware of the role of vitamin D plays in overall health. And once you do, you can make necessary adjustments in your diet and lifestyles, and also the sun exposure needed for your optimal health. So, if you are experiencing some or all of the symptoms in this list, it may be the time to schedule a quick blood test to see if you are suffering from vitamin D deficiency. Enjoyed this video? Don't forget to hit the like button and subscribe to our channel to get more informative videos like this. Thank you for watching.